Conversely, what I think is really important is that you are able, sometimes it's quite small organisations, to be able to cover any gaps you might have within your staffing. Now, Essex County Council is, as you know, a huge organisation. We can be pretty clear that with 20% absency at the peak of the epidemic, that 20% is going to be 20%, 20%, 20%, 20% by week. In small organisations, much more likely to be a bit and starts. So very well with you have 50%, 60% of the workforce off for 2 weeks, get everyone back. So the question is, how do you help each other for those sudden peaks, those sudden hits, because you will be hit at different times over that period. The final thing I want to say, I think it's really important, is this issue of social distancing. The best thing that we can do, to protect older people and protect getting this condition is to absolutely minimise our contact with them. Now, I'm sure older people will be well up for that. It reduces their chances of getting this terrible disease for them, and that will be really for you as to try and actually restrict as much as you possibly can visits from outside people for that period of a couple of months. If we can absolutely put in a cocoon, isolate the older people who we are serving, then that is the best thing we can possibly do to support them. Is that enough for me to say? Yes. Oh, yes, sorry, yes. And in the meantime, I just want to point out, and it is entirely appropriate, to yourselves, not just at work, but elsewhere, I cannot stress enough the importance of hand hygiene. If you happen to be in an area where somebody's had a condition, touch the surface and you pick up that bacteria virus on your hand, then there's a fair chance you can transfer. If you wash your hands very, very frequently, very, very well, then you're much less likely to bring it home to your children and pass it on to your charges at work as many times as is possible during the day. Thank you.
Right. I should have said at the beginning, as we'd sent out in the communication, we've got mechanisms for questions. The software, we've also got Slido running. So if you want to pose questions, we've had a number already really helpfully. If you can use one of those methods, we'll then at the end we will go through those. Some we can answer, some we will tell you what we're going to do in order to generate a response. So thank you. So I'm just going to move on to in this phase. It's really important to follow this is going to be true generally. It's really important to follow the guidance consistent with recommendations of Public Health England. What we're seeing is a number of organisations are starting to preempt that guidance and put in place their own restriction. We think that's going to start to create problems before we're hitting the kind of phases that Mike's describing. So we would urge you to follow the guidance as it's currently set out in each of the phases of the work. And if we do that, then we should be able to we can make better use of the capacity that we've got. If you've got any questions on that, we would urge you to get in touch with us. We've got a central email which is part of the presentation, and we will endeavour to get back to you as quickly as possible. So most responses we've been able to kind of turn around either on the same day or within 2 days. And where we have to answer questions, we have to ask questions centrally. We're generally getting responses within a couple of days, so it won't be that you're waiting weeks and weeks for a response. So the current guidance is in the phase we're in. We're not recommending closure while someone is undergoing testing, and that's based on national guidance. And people who've had close contact with a confirmed case do not need to take precautions and continue their routines as usual. We are seeing a number of organisations that are preempting that guidance, and if that happens a lot, that's going to cause us problems at this particular moment in time. When we're in these kind of extreme circumstances, the NHS and kind of public sector goes into a command and control process. That's a very tried and tested process. So our strong recommendations is to follow advice from Public Health England and seek specific advice. Because if everyone does that, then we've got a better chance of managing the problem overall. want to emphasise from an Essex County Council perspective, we recognise that your primary concern is the safety and the well-being of the people that you're supporting. And obviously, everything that we do, everything we want to do as a council, has got to be to that end. We're going to have to be quite pragmatic, quite fleet of foot. We appreciate your continuing engagement with us and the work that you're doing. You're very much at the front line of some of this work, as our NHS colleagues. And we also want to make sure that staff are safe and well. They're a really critical component of the wider system, and want to support your work. So what we want to do is keep in communication with you through different routes, and we'd encourage you to keep in contact with us. If we can solve problems, we will try and do that together as quickly as we can. You will appreciate from the national news, the situation is incredibly fast moving. So it's really important you're keeping abreast of the latest guidance and the latest developments. We will get those out to you as we receive them, so that will be posted on the portal as we get those. So the latest information and advice will be there. A question for you, perhaps one for responding back to us. We can either directly send information out to you as we receive it, or perhaps do that on a daily basis, or as things change. So if you've got strong preferences about that, it would be helpful to know through the comments. And to state the obvious, as part of business continuity, if you can make sure that you are actively checking whether or not information has been sent out, and if the person that normally does that is off sick, make sure you've got a backup. So let us know the best routes to get in touch with you and maintain that contact. And as I said, it's really important that we ask you to follow current guidance rather than make your own decisions, as this can cause early problems, and we are seeing a little bit of that already, and equipment shortages. I know we've had some questions about personal protective equipment, so we'll just mention that in a minute. And the guidance that we're seeing is based on the best scientific knowledge to date, and very tried and tested procedures around emergency planning, both nationally and internationally. So even if it feels a bit counterintuitive, there will be a rational basis for why we're asking you to do the things that we're asking you to do, as well as talking to kind of wider colleagues within the market. As we move potentially into the next stages of the spread of the disease, some of the normal processes where we'd be keeping in touch with you about what's going on in the market are probably not going to work. So we want to test with you today a couple of things. One is that, Mike is referring to, one of the significant risks that could happen relatively quickly would be school closure. So over and above the fact that staff might be off sick, we may also have problems about staff not able to work because of childcare or school closure issues. So what we would like to do in this phase before that happens is to understand the impact of that on your workforce. So later on today, we will be contacting you and asking you to give us an update on what you think the impact of that will be on your workforce. On the presentation, we've got an example of the form. It's a Microsoft form, web-based information that we can then collate centrally. We'll use that. So in testing that, we then think if we move into a phase where there is significant spread of disease, we will want you to be doing daily updates on what staff you have available, which packages you're able to cover, or which people you're able to support, so that we can look at that on a day-to-day basis and understand what we might need to have in place in terms of mutual aid. Our thinking currently is that we will bring together either a central team or a quadrant-based team of operations colleagues, or placement team, and potentially some key providers to take an overview of all the capacity we've got in the system on any one day. So in order to support that, we'll probably need daily updates. Not at this stage. We will advise you when we move to that phase, and we'll be using to do that as through Microsoft Forms update. If you think that's problematic or you've got any comments around that, it would be really helpful to share that via Slido or via the email. The email we've got on here, and we will share that, is the providerresilience@essex.gov.uk, the line. We've also had queries about access to hand sanitizer, and are in discussion with the NHS about whether securing priority supplies. I think that is unlikely based on conversations I've had in the last couple of days. Said hand washing with soap is still the preferred route. That's most effective at minimising the spread of the virus, and that's very much Public Health England guidance. We do recognise, however, that in some cases, particularly for those of you in home care, you may be in environments where the hand washing facilities are not great or less sanitary, and there'll be occasions when you need to use it. If we will continue to ask questions about whether there's opportunities for priority access to hand sanitizer, and we'll advise you accordingly. At the moment, that isn't happening, but we will let you know if that changes. The other thing, as Mike said, is we are expecting that for those people that are currently in informal caring arrangements or family support, we may need to provide additional support if the main carer or the only carer is sick and needs to isolate themselves. It's very difficult to know what sort of impact that would be likely to have. And obviously, we don't necessarily have access to all the people who are currently informally caring. So we're going to need to look at that on a case-by-case and day-by-day basis. So it's not just about the service users and self-funders that we currently have in the system and the children we're supporting. There's potentially a wider issue about people needing support only when above what we would normally be doing. And one of the really practical things that you can do at the moment, as we've said, based on the form we want to collect, is to understand how many staff are going to be affected by school or nursery closures should that happen. For you to understand as an organisation, because it might have a compounding effect on availability of staff. We also want to understand that so that we can understand what sort of impact that might have. Clearly, if people have got other sources of support, if they can use family to provide some interim childcare, that's helpful, but we recognise that won't be the case for everyone. That's all we're going to say at the moment. We've had a number of questions and we will attempt to go through them. You can continue to add questions. The aim will be to try and add them into a frequently asked questions, and we'll keep that updated on the website, so we could and obviously recognising the guidance is likely to change. So changes or as the situation changes, we'll keep you updated in terms of understanding the queries and questions that you've got. So what we're seeking to do is get the questions that you're asking us, understand from the budget and central government guidance the next day or so what support is going to be offered by central government direct to you as businesses. I also understand from the news this morning that the Bank of England's been in touch with some of the lenders and looking at holiday periods around loans. So it's worth looking at, obviously keeping abreast of the news from there. We would take all of that into account. I think the principles that we're really clear about. One is we need to find a mechanism to ensure that staff who need to be off sick or need to self-isolate are not financially penalised. You're looking at that as employers. and we recognise we will need to provide some support to you, particularly where we know a number of staff are on 0 hours contracts, so we will significant implications for your financial planning and cash flow. It is absolutely not in anyone's interest for organisations to fail over this period and in the immediate aftermath as a result of issues like that. So we recognise that we will need to look at how we can address that. We will be having conversations in the next day or so and seeking support from corporate colleagues in how funding mechanisms can work, and we will come back to you as soon as possible, and the aim will be that will be in the next few days, because we do recognise these are a significant concern to you as they are to us. We don't want any organisation in financial and other difficulties as a result of this, and we certainly don't want organisations failing over this period. So we will come back to you as soon as possible on that. A couple of comments about frequency of communication. We'll gather kind of views on that. So what plans can we put in place if we have staff shortages due to school closures and self-isolation? I think we absolutely anticipate that will happen. The reality is, given the situation across the country, there isn't a mechanism to pull a lot of additional staff into our services, into support. We're going to have to make the best use of the staff that we've got in the system. We're obviously looking at all the staff that we're able to deploy in our kind of care functions within the council, but also testing whether other people within the council who have caring backgrounds, perhaps historically, and how we can use those. But that won't make up potentially for the gaps for the number of people that we are anticipating will be off. So we're going to have to look at probably daily prioritisation of individuals' visits and to look at how we can support individuals and keep people safe. We will do some more thinking about that and some further engagement with you about, in practical terms, how that would work. As I say, what we're looking at is trying to kind of in a central way gather some of that information in order to engage with you about how we can prioritise where staff should be and whether we can provide support around packages. In order to do that, the really critical thing is we need to have that active dialogue and that information from you, both in terms of where you've got spare capacity, where you've got staff who are able to work, where you've got staff that may be able to do additional hours, but equally where you've got problems and issues. We're working through in practical terms how that might work. We'll have some further dialogue with you in order to come to some recommendations, but again, that will need to happen pretty rapidly. But the reality is, I think we'll need to look at what the situation is on a day-to-day basis. We'll obviously pull in all the people that we can, but we're not anticipating there's a large group of staff that we can bring in to support this.
They have to get them together.
We will support that process around mutually. Another question is request that ECC pay contracted hours rather than delivered hours during the crisis. No budget hit for ECC, but ensure financial viability to us. I think I've addressed that already. We recognise that is an issue and we need to come back with practical suggestions on that. We're working through that in the next day or so. Again, direct payments, we will need to look at service users on direct payments, kind of in a similar vein. And we will look at charging as well. There are legal mechanisms where we can address some of the issues around charging. So again, we will come back to you once we've gathered all of this with some practical suggestions on that. Again, we don't want to create perverse incentives in the system. Do we have a contingency plan for other providers that can be shared? Not one plan. Obviously, you all have your own business continuity plans. The NHS has their own business continuity plans. As I say, I think we're going to need to do that on a day-to-day basis in terms of understanding what staff we have available in the system and what demand we've got coming in. Okay, just another question. There are approximately 43,000 over 85s in Essex, with worst case scenario of mortality at 20%. Is there planning for around 8,000 to 10,000 additional deaths? We do have plans and emergency plans around deaths and access to mortuaries, which will kick in should excess deaths exceed our current capacity. It's a question that came up in one of our emergency planning sessions day before yesterday, and we've been assured that plans are in place. So we will communicate to you as those if those plans need to be initiated. But my expectation is you should run your normal processes, and it will be through the coroner and the kind of mortuary services that we would address where people need to go, and obviously we would advise if there's any change in guidance. Mike?
Yeah, just to add, if I could, I think that those numbers are correct, but if we do the social distancing well, and that's down to you guys more than anyone else, then we can reduce that very substantially. We can reduce it in half. So absolutely critical to this is going to be getting the social distancing right when it's the time to introduce that.
Okay. I'm just looking to colleagues who are monitoring questions. Are there any other ones? There's a lot of questions. We won't be able to answer them all. We will gather them all and try and cluster them so we can respond. Are there any others that sort of cover different themes that we need to pick up? One of the questions I just want to ask at the end is whether it's helpful to perhaps run some more of these type of sessions. So maybe we'll just check that, and again, let us know if that would be helpful. But we will, if we are doing them. One comment is there anything extra we can do to help ECC and the NHS through the coming weeks? As a healthcare trainer, I could offer hand hygiene, infection control workshops, etc. That's an immensely helpful offer if there are people with additional skills that perhaps they're not using. Again, we'll look at how we can maybe gather that through the mechanisms we've talked about. Any offers of that kind would be extremely grateful for. Okay.
So somebody's written it doesn't appear to have started, and that's correct. At the moment, there is very, very little coronavirus circulating within the community in Essex, and those cases we have had are generally can be linked to abroad. It hasn't started yet, so that means at the moment it's very, very unlikely if any of your clients get ill and they haven't had contact elsewhere that they've got coronavirus. However, it will start stepping up. We will see more and more cases in this, but at the moment, I think it's correct. I think within our community, there aren't any cases circulating at the moment, which is why we haven't stopped public events and things like that.
Do you want to answer that one, Mike?
I would if I could read it.
Okay. So the question is, do care staff who have been abroad on holiday need to be screened by their GP if not symptomatic?
So it depends where they've been on holiday. I think you really have to go to the Department of Health website, and because this is updated very frequently. So it depends where you've been on holiday. Anywhere in Italy, then yes, you have to self-isolate straight away. Anywhere from Iran, I think is the same. Parts of China is the same. There's a whole bunch of other areas where it's okay to go to work unless you've got symptoms. But I would absolutely urge you need to keep a daily look on the government website, because it does change frequently, like it changed this week. And I would recommend the government website rather than the NHS one, because the NHS one actually takes a little bit of time to catch up with the government one sometimes.
Okay, further question is, how are providers going to be supported when there's going to be an increase in waiting times for paramedics? That's, I think, a tricky one. Certainly will be an ease pressure on ambulance services at the moment. So again, it will probably be on a case-by-case basis depending on the pressures. There are contingency plans in the ambulance service to look at movement of people with COVID-19. And obviously, as far as possible, we will want to try and keep people at home, because people going into hospital associated with COVID-19, if they don't have COVID-19, will create additional problems. Clearly, where someone needs to go in, then we'll need to risk assess around those individuals. Again, if you can keep us informed if that is a problem, I think the reality is, again, we're going to need to support people on a case-by-case basis. We recognise it's a challenge at the moment where a carer goes in and identifies someone that needs has got significant needs sick. Not an easy answer to that one, I'm afraid. Is there anything else? Any other questions? So there's, should we be limiting community activities? Families are asked to cease activities in the community. So yes, so the current advice is that's not the case. We're not in a phase where that's being recommended. We will obviously keep an eye on the guidance, and there may be a point where we determine that day activities and day services should cease, but I think that's got to be based on the risk as we currently assess it, and we will talk to you about that. So things should carry on unless the guidance changes, and we will communicate with you about that and what we will do. So clearly that creates additional problems if we've got individuals who would have been in day services who then have to be supported at home, and we'll need to understand what the impact of that would be likely to be at the point that that happens. What do you suggest with our learning disability service users who access the community daily? So again, the advice is currently that should continue until the point that there's a recommendation that either those individuals self-isolate or there's restrictions on public movement. If that guidance changes, you'll obviously hear that on the news nationally, but we will also advise you. When can we expect to receive ECC comprehensive strategy document for dealing with the expected wider outbreak of coronavirus? So we won't be issuing separate guidance. We will be sharing the recommendations. Can the person that's just joined mute, please? We will be sharing the guidance. If there's clarification on that, we'll probably deal with it through the frequently asked questions process, but we won't be able to customise the guidance nationally given the speed and the frequency of what is coming out. We will be directing you to national guidance, and we will support you in the interpretation of that, either through public health group or through colleagues that you would normally be dealing with. Okay. So is there an expectation they look to close schools in line with the 2-week Easter holiday to reduce the impact of the stop early? What to respond
to? The decision to close schools is actually scientifically driven. So what happens is that at the moment there's containment and there's absolutely very little disease out there, so you need to close the schools. The thinking is when you get a fair amount of disease out there, it'll spread quicker if the schools are in. So there's a particular time at which it's optimal to close the schools. And that's the time at which the peak, the curve is starting to rise, and we're starting to see far more cases in the community. If that happens, then a decision may be made to close the schools and nurseries and further education institutions. If they do that, they'd have to do it for 8 weeks. That may or may not include the Easter break, but in a sense, it'll be determined by the epidemiological curve rather than the convenience of Easter holidays.
I'm going to take one more question because we're coming up on 12 o'clock. We will, however, review all the questions and seek to get you responses directly and through the website. So there was a question about shortage of pharmacies due to infection. What assistance can we expect to receive to ensure service users receive their medication in a prompt and orderly fashion? I will take that one back to our calls with the NHS about what the contingency plans around pharmacies are, and we will advise you. So you should continue to use the processes and the contacts that you currently have. And if there are changes to that, or there are particular problems in terms of supply of medicines, we will advise you accordingly. But I will ask for the contingency plans in the NHS around that. Thank you, everyone. I appreciate that some of the background noise has made it difficult for people to hear. It would be helpful to know whether this format is useful to impart information. Some people have fed back on that already. and apologies for some of the sound quality. And thank you very much for joining. We've had a large number of people join. We recognise that we're all concerned and anxious and keen to do the right thing here. So whatever is the most helpful way of communicating and engaging with people, we're really happy to continue to look at, and we will keep you advised and updated as we get changes to advice and guidance. Thank you for your time, everyone.